Have you ever felt pain on the side of your toenail when you put on shoes or walk? That sharp, tender sensation might be an ingrown toenail, a very common condition that can be easily prevented but sometimes get overlooked. Hi Healthy Buddies, I'm Dr. Tirta Wijaya. Welcome to my channel where we will talk about various health topics. Today we are going to talk about ingrown toenails, what it is, why it happens, how to tell if it is serious, and what you can do about it at home, and when you have to see a doctor. An ingrown toenail, medically known as unguis incarnatus or onychocryptosis, occurs when the edge or corner of a toenail grows into the surrounding skin rather than straightforward. This causes irritation, localized inflammation, and sometimes infection. Most commonly, it affects the big toe, but any toe can be involved. This is a very common foot complaint. In fact, roughly 1 in 5 people who seek care for foot problems report an ingrown nail. It affects everyone, men and women of all ages, but it happens more commonly in teenagers, athletes, people who wear tight or narrow shoes, and people with diabetes, poor circulation or nerve damage, and those with genetically curved nails. Risk increases in teenagers because of growth spurts during this period, with more foot perspiration and nail growth. Athletes in sports with repetitive toe pressures and injuries, for examples like kicking the ball, are at higher risk because of the toenails can grow inwardly after the injury. People who wear tight footwear or narrow toe boxes have higher risk of ingrown toenails because the shoes are molding and affecting the shape of the toes and toenails. Patients with diabetes, poor circulation, or peripheral neuropathy have higher risk because they may not feel the initial pain and tend to come in advanced condition. Common causes of ingrown toenails includes incorrect nail trimming, cutting nails too short, or rounding the edges instead of straight across. Number 2 is ill-fitting shoes or tight socks applying pressures to the toe and toenails. Then trauma like stabbing, jamming, repetitive sports stress, and curved nails that naturally grow inward. We also have genetic predisposition and of course, poor foot hygiene. Symptoms often include pain and tenderness along the side of the toenail with increasing pain when wearing shoes or walking. Then redness and swelling of the skin around it. Warmth, especially if infected, and sometimes pus or drainage from the area. These symptoms can get worse if infections sets in. That being said, there are other conditions that may cause quite similar symptoms to ingrown toenails, like pyronychia or infection of surrounding skin not caused by the toenail, toenail fungus, or traumatic nail injury. These different conditions are caused by different things and require different treatments too. Treatment for ingrown toenail won't work on toenail fungus, vice versa. That is why correct diagnosis is important to decide the treatment. If you are not sure about your condition, please visit your doctor to get proper diagnosis. For confirmed ingrown toenails, there are several treatment options depending on your condition. For mild cases without signs of significant infection, we can apply some home remedies like soak foot in warm water for 15 to 20 minutes, about 3 to 4 times a day to reduce the swelling. We can also lift the edge of the toenail and place a small piece of cotton under it to encourage proper growth. You can protect the skin around the toenail edge with plaster. Then wear roomy shoes or sandals. Then we can also take over-the-counter pain relief if necessary. Whatever you do, it is important not to cut deeply into the nail edge. This may be counterintuitive, but cutting the nail edge often makes it even worse as it is increasing the risk of infections and allowing the nail to grow back into the flesh. If home care fails or symptoms worsen, we need to get doctor's help. Depending on your toenail condition, your doctor may do professional nail elevation and gentle trimming under sterile condition. Do splinting or gutter placement to hold nail up while it grows out. For chronic, recurrent, or more severe condition, your doctor may recommend more definitive treatment options like surgery. Your doctor can do rhinoplasty or nasal extraction, where the offending toenail will be removed by performing partial or total nail avulsion. Please note that clinical total nail avulsion is rare. Doctor usually will only remove the entire toenail if it is causing recurrent or severe condition. Then, the toenail avulsion can be combined with phenolization to cauterize the nail matrix, preventing it to regrow. Compared with surgical toenail excision without phenolization, partial nail avulsion combined with phenolization is more effective to prevent ingrown toenail recurrence, but it has a slightly higher risk of post-operative infections. Other options are electrocautery, radiofrequency, and carbon dioxide laser ablation of the nail matrix. After surgery, healing may take days to weeks and full nail regrow in months, depending on your overall health. Recurrence can still happen after surgery, but it is much less common. To lower our risk of getting ingrown toenail, we need to trim our toenails straight across, not rounded. Avoid cutting them too short. And wear shoes with ample toe space. Do not cram it. Then we need to protect toes during sports and keep feet clean and dry. If it is not getting better or the pain affects your quality of life negatively, it is best to visit your doctor. As we all know, a stitch in time saves 9. Early professional assessment can prevent complications. The red flags that require urgent medical attention include severe pain not improving with home care, fever or spreading redness, pus drainage or foul smell, diabetes or circulatory problems, and numbness or inability to feel the toe. If you find this, please seek your doctor immediately. That is my sharing today about ingrown toenails. I hope you found this video useful and can be a blessing. If you like this kind of information, please give it a thumbs and subscribe for more clear medical explainers like this. If you have health-related questions or topics you'd like me to cover in future videos, kindly let us know in the comments. But please do not consult your personal health issues here. This is my disclaimer. See you in the next video. Stay healthy and happy.